So we developed a facility with our physics staff and working directly with the engineers that would allow us to treat things that had never been able to be treated before with proton therapy. Moving tumors, such as things in the lungs, things that were very difficult to target and treat. So that was built into the design of the facility, which has allowed us to be able to grow, to treat indications that hadn't been treated before. And also, another priority was to make sure that we were studying how we were using protons. It's a limited resource. At the time, there were only 6 functional facilities in the country when we were given approval to build. Now there's almost 40 that are currently under treatment or open soon, but still only 40 for our entire nation. It's a limited resource. So we wanted to be able to make sure that we were studying how we use proton to make sure that we were using it for the patients who needed it the most, meaning that the reduction in toxicity was something that was meaningful for their tumor, and that the improvements in outcome, that we were saving it and making sure we're using it for the patients who could have the most improvement in their cure rates or outcomes. 20% of our patients enroll in clinical trials compared to the national average of about 3 or 4%. So a huge proportion of our patients are being treated on clinical trials that have allowed us to now demonstrate that we have lower cost because of fewer toxicities, hospitalizations for head and neck cancers, esophageal cancers, lower heart toxicity, better outcomes from hard to reach tumors like brain tumors. All of that has been part of the program from the beginning, the idea of the program from the beginning, that we were studying it, we were using it responsibly, that we're making it available for the patients that need it the most. Because we are a regional center, there are not very many proton centers nearby, and there are many patients that we feel can benefit from proton treatment. We have extended the hours to treat from 6 to 7 a.m. to midnight to be able to make sure that patients who really need this therapy can have access to it. But even with that, even with those extended hours and sometimes occasionally Saturday hours, even with those extended hours, we are at capacity, we're full. And so we have never turned away a child, and we never will, and we have always made room if it's medically urgent. But for cases where we have some flexibility in time, now there are delays in the time of start, waiting lists for certain diagnosis where we have some flexibility, and that can be a month out. So we do need to increase our capacity. We do know that this is, as we've studied the treatment with protons in multiple tumors from head to toe, that there are many indications that can benefit from protons. So we are planning on an expansion that will allow us to have more capacity, 2 more rooms. We have 4 gantries now, so 4 rooms where we can treat patients, and we are planning to increase that by 2 more to allow more patients to receive this treatment. The success of our cancer patients depends on a collaboration, and that's really what our Mayo's strength is. It depends on the collaboration between multiple other departments. This has been a huge collaborative effort throughout the whole institution, and that is really the reason why it's been successful, is that we've had the collaboration and support of so many people in so many areas as we take care of our cancer patients.